Now, this time of year, we deal with the colder temperatures, and oftentimes it comes with sickness. Yay, the joy of illnesses. Plus, a lot of the winter months also come with winter allergies. Dr. Wada joins us this afternoon to talk more about dealing with those. Doctor, welcome in. Thanks so much for joining us.
Thanks so much for having me.
Now, honestly, I always think flu, RSV, COVID. I don't think allergies. Why do those technically, go hand in hand, especially with this winter season?
So the cold, dry air makes our nasal passageways and our sinuses more prone to becoming irritated. And that also increases the likelihood that we may have allergic symptoms too. So when we think about the allergens that we see across the country, dust mite is one of the big winter time allergens, along with our pets as well, if we have cats, dogs, or other furry critters at home.
So then when it comes to, obviously, I don't want to get a Fluffy. I love him very much, the allergens. So what are the smart ways to kind of clean it, and then maybe less cost effective? Because of course we know sometimes they can be expensive, but what are some cheaper ways?
Yeah, so I always love to think about a three-pronged approach to allergies. One, minimizing our exposure within reason. So with dust mites, we can't get rid of them. They're part of our environment, but we can decrease our exposure to them by washing our sheets on hot and drying them on the hot cycle about once a week. We also can pick up pillow or dust mite covers that completely encase our mattress, and that also can be quite helpful and pretty cost effective. Last but not least, running the vacuum, about once a week can be really helpful as well, both for dust allergy and for pet allergy. And although, most modern allergists aren't going to tell you to rehome your pet, that's kind of, not helping forge that good physician-patient relationship, we do talk about possibly trying to keep those fur children out of the bedroom to give our bodies time to rest and recuperate overnight. Medications are also really helpful, and then immunotherapy, so things like allergy shots, drops or tablets also can be really helpful at moving the dial with symptoms.
I was just going to say, yeah, I feel like those are, valid compromises. So Fido can't come into the bedroom, but there are certain places in the house that, like we said, we run the vacuum, we wipe a little bit more, and we contain the allergens. Now, my next question to you is, in addition to containment, how do I know the difference between, or is there really a clear sign between, let's say, a cold versus, for sure, allergies?
It can be really hard to tell the difference this time of year. One of the ways, though, is to know your allergy profile. So getting allergy tested can be really helpful to know, could this be allergies or is this really a cold? Also, our response to medications can be quite helpful. If we are having some improvement with something like an over-the-counter allergy tablet, like a fexofenadine or a cetirizine, then that would lead me to say, oh, this maybe is more allergies. And then the duration of symptoms. So most colds are going to last somewhere between a week to 2 weeks. If it's persisting longer than that, then we may also be thinking about allergies as driving their symptoms.
And when I think of those things, do I need to immediately run to my physician? Do I need to run to the ER? Like, if it becomes too prolonged, what's the most extreme case I need to deal with, I suppose?
Yeah, so things that I would recommend, if you feel like you're getting better from that cold and then you have a sudden second worsening where it feels like you got sick all over again, probably worth getting checked out. If you're noticing that you have significant pain in your face or with eating, feels like tooth pain, or that pain really changes and becomes quite severe with moving your head around, also probably a great reason to get checked out. And if symptoms are lasting for more than 2 weeks, again, another reason that there may be a sinus infection going on and may warrant an evaluation by a professional.
And this is a recommendation regardless of whether itty bitty or full adult. Like, these are honestly full steps all the way around for people.
Yeah, these are generally reasonable steps for most folks. The other thing that I think is important when you think about allergies and sinus infections is really trying to have that person that takes the lead, because if you do have frequent infections, you're needing antibiotics quite often. That's another reason that it would be really helpful to connect with an allergist, immunologist, to make sure, are allergies playing a role? is my immune system able to fight off these infections adequately? Or is there something structurally going on that maybe is making me more susceptible to infections too?
Doctor, I appreciate you taking the time. Is there anything else you want to make sure that we mention when it comes to just being able to treat, recognize the signs, and then, of course, hopefully leading a much healthier winter season in life?
You know, our daily habits really do make a difference. So getting your rest, drinking your water, getting some exercise and eating your fruits and vegetables, all those things really are, ways to naturally boost your immune system and help you fight these things off and fend off some of those allergy symptoms too.
Dr. Wada, thank you so much for taking the time. Again, it's always about treating yourself healthy and then, of course, being aware of the signs and then, of course, taking the medication and the proper steps in your home when you need it. And we will be right back.